Greetings, everybody. My name is Andrew Grulich. I'm the head of the HIV Epidemiology and Prevention program here at the Kirby Institute, and welcome to the Kirby Institute seminar series. I'd like to start by acknowledging the traditional owners of the land that we variously gather from today, and I'm coming to you today from the lands of the Bedegal people of the Eora Nation. And I would like to in acknowledging that, I would also acknowledge any Indigenous people who are joining us today. As usual, the format of today's seminar is a presentation followed by a Q&A. You access the Q&A function through the Q&A bubbles probably at the bottom of your screen. Please do feel free to start asking those questions during the presentation so that we've got your questions to begin with during the Q&A. Our speaker today is Dr. Huachun, or Professor Huachun Zou. Huachun is Professor and Head of the Department of Epidemiology at the School of Public Health in Shenzhen, in Sun Yat-sen University in China, obviously. His research areas of interest include the epidemiology of HIV, human papillomavirus and other STIs in at-risk populations, interventions to prevent those infections, human papillomavirus and HIV-related cancer epidemiology, and vaccination for HPV. His previous research has demonstrated preliminary evidence that circumcision may prevent HIV amongst men who have sex with men, and the natural history of HPV in teenage men who have sex with men. Please welcome Professor Huachun Zou. Over to you.
Well, thank you very much, Andrew, for your introduction. I'm very honored to be here today to talk with you about HIV pre-exposure prophylaxis in China and challenges and opportunities. So I'm going to present today's talk in the following three parts. The first is introduction. So most of us must know that HIV PrEP, otherwise we call it Truvada, but there are other forms of the drug. And you can see increasingly people are using it and showing it on dating apps. There are multiple delivery systems for PrEP, either oral, vaginal gel, vaginal ring, and long-acting injectable. As you can imagine, there are many forms, and I think there are forms still to come. But this data from a few years ago, I think they are much more advanced now. So the effectiveness of PrEP increases with the increase of adherence. So here we can see the EPIC New South Wales study. It's like kind of a game changer. In 2017, the former director of Kirby Institute, Professor David Cooper, said that today marks a moment in history for HIV in Australia because we are seeing a rapid decline in new HIV infections, particularly among gay and bisexual men, a main population targeted by EPIC New South Wales. The number of gay and bisexual men diagnosed with HIV within 12 months of infection in the first half of 2017 is 39% lower than the same period of time over the past 6 years, and is the lowest on record since 1985. And by then, I think nearly 7,000 men were on PrEP recruited in this project. So here I'd like to acknowledge Professor David Cooper, because this photo was taken in Guangzhou in 2017 when he visited Guangzhou, and I took him to a Cantonese restaurant, and I had a very nice talk, and he encouraged me to work in HIV prevention field and try to be, industrious and innovative as possible. And thank David, and you're in my memory. So as in terms of awareness and willingness, this is a global systematic review and a meta-analysis which found that the awareness has been increasing, which is good. But the willingness, like in the first couple of years, it was really high willingness to use a PrEP, but then it dropped. And then from 2014 also, it picked up a little bit of its momentum, but still not very high, the willingness to use. And in some countries, the willingness to use is even lower. So these are some of the correlates of the willingness to use PrEP. For example, this is a number of sexual partners. If you have more sexual partners, you are more likely to use PrEP. And if you have a higher education and you have a lower willingness to use PrEP. So, and we have two studies coming. These are the two existing studies. This study is from Australia. Most of us must be familiar with this. So it shows that for any STI, so compared to non-PrEP users, PrEP users, their incidence rate ratio for any STI was 1.41, which means PrEP users have 41% higher chance of getting any STI. And for adjusted IRR, it's 1.12, which means overall PrEP users have 12% higher STI infection. And for chlamydia in particular, it's 17% higher. But if you look at the table, you can see all of the STIs listed here. They have high incidence for individual STIs. Even for syphilis, the incidence was 8%, or 8 per 100 years, which is very high. And another study just published in Eurosurveillance showed that the risk compensation doesn't exist. While the Australian study showed some increase in STI, but here from this graph we can see most of the all of the p-values are quite high, which means PrEP users and non-PrEP users, their STI incidence rates are kind of identical, kind of comparable. So which is complicated or a little bit contradictory, which means it takes more studies to prove whether HIV PrEP increases STI risk. So HIV/AIDS in China, I would take 2019 for example, because that year wasn't yet affected by COVID-19. COVID-19 actually affected the HIV epidemic in China. So in 2019, about over 150,000 people were newly reported to have infected with HIV. These are the reported number, not the actual infected number. And people, so nearly 1 million people were living with HIV/AIDS, and over 20,000 people died of HIV/AIDS in the country. So from this graph, we can see HIV prevalence among key populations. So the prevalence among men who have sex with men and people who inject drugs were just under 10%, somewhere around 8% also. So here So from the beginning of the epidemic to 2019, we can see increasing numbers of HIV/AIDS cases in China, whether it's a death or in AIDS cases or HIV/AIDS cases. And this graph showed that so from the beginning of the epidemic to 2017, the change in the distribution of different risk populations in all HIV infected people. And we can see an increasing proportion of MSM in this population. And I think it's still increasing now. This is 5 years ago, but now it's higher. So the strategy of PrEP in China are as follows. Even though PrEP has been used in Western countries for, I think, over 10 years, still a kind of a new thing in China. In 2016, China included PrEP in its HIV prevention intervention guidelines for MSM. In 2020, China introduced event-driven PrEP dosing regimens into the consensus statement on human immunodeficiency virus pre-exposure prophylaxis in China. And in mainland China, there is still a lack of national HIV PrEP guideline. But China just finished PrEP and RCT, which was published recently. So I think soon there will be a national HIV PrEP guideline. It is urgent to issue new PrEP implementation guidelines to provide standard guidance on PrEP medical entry criteria, timing of drug administration, drug safety, and counseling and testing, etc. So this is the practice of PrEP in China. We can see the criteria is listed in HIV prevention intervention guidelines for MSM as early as in 2016. So these requirements were similar to other countries as well. So 18 years older and older, HIV inactive, inconsistent condom use, things like that. The preferred PrEP is Truvada, or the combination of TDF and FTC. Once PrEP is initiated, the person taking the medication needs to receive a follow-up visit within the first month and every 3 months thereafter. And there will be a few follow-up visits as well. In 2017, this book was published, so HIV/AIDS in China. It showed low acceptance and lower adoption of PrEP, and it was kind of pessimistic about PrEP at that time. And one of the demonstration studies, like back then, about 7 or 8 years ago, they recruited over 1,000 MSM. Only, about 20% of them were willing to take the medicine, and only 2.5% actually used it. So, which made it impossible to assess the efficacy. So for research development about PrEP in China, I'll talk about the acceptance, adherence, efficacy, safety, cost effectiveness, and others. So the the acceptance rate is upper and moderate, but the awareness rate was low. So for acceptance, different studies showed like around 50 to anywhere between 50 to 80% would accept, but the awareness rate was really low, generally under 35%, and especially for long-acting injectable PrEP, it's even as low as 7%. So this study published in JIES showed that the number of male sexual partners and the subjective assessment of being very high risk of HIV infection were associated with increased preference for daily PrEP, for daily versus on-demand PrEP. But the effect was really marginal, only like 0.3% higher and 10.5% higher, respectively. So in terms of adherence to PrEP, this study did a multi-center real-world study of Chinese MSM on daily and event-driven PrEP. Participants were followed up for 12 months, and during follow-up, geosocial networking apps users had a significantly lower level of pill counting adherence than non-users, and the adjusted odds ratio was 0.8, which was statistically different. So in the event-driven group, GSM app users had lower PrEP coverage of sexual practice. Adjusted odds ratio was 0.6, and GSM app users are highly prevalent among MSM, despite their higher sexual risk and lower adherence levels, suggesting that e-health needs to be introduced to the GSM platform to promote PrEP adherence. And in a mathematical modeling study with 100% PrEP compliance, the required PrEP coverage rates for achieving HIV elimination in the next 10, 15, and 20 years would be 65, 32, and 19% respectively. PrEP could reach the goal of AIDS elimination by 2037 when it covers more than 50% of high-risk MSM, which is really ambitious given the very low the low awareness and a very low uptake rate currently. It is necessary to improve PrEP adherence and coverage to further control and eliminate the epidemic of HIV/AIDS in MSM. So in the randomized controlled trial, in terms of efficiency, it is efficient. So daily PrEP can prevent 88%, and event-driven PrEP can prevent as high as 95% of incident HIV infection among high-risk MSM in China. In terms of safety, basically safe, and there was no difference between the two groups. In the meta-analysis, the PrEP significantly reduced HIV incidence with low rates of HIV incidence among PrEP users. And so safety, no significant difference was detected between two groups, and no risk compensation was detected in the meta-analysis. And here, this is a combined, so relative risk of PrEP on HIV incidence was 0.244, which means, so generally, so 75% reduction of incident HIV. And this is a, so adverse effect, 13%. And there is a phase 1 study assessing safety and the tolerability of long-acting cabotegravir in 47 HIV-negative adult Chinese men at a low risk of acquiring HIV-1. And it's just published, so I think the study is still ongoing. Cabotegravir long-acting injections were acceptable and well tolerated. And common adverse events included injection site pain, injection site swelling, and upper respiratory tract infection. And no drug-related serious adverse events or death occurred. So Zhang and others evaluated the epidemiological impact and the cost effectiveness of implementing PrEP in Chinese MSM over the next 2 decades. And they used a compartmental model, and they used DALI as a parameter. And the epidemiological impact is as shown on this graph. So an assumption of PrEP coverage of 20, 50, and 80% would enable 0.5, 1.2, and 2 million MSM to receive preventive intervention. So you may wonder how many MSM are there in China. And it is estimated to be anywhere between, let's say, 5 million to 50 million, anywhere between that. So they have wild numbers in terms of the total population of MSM in China, based on different study methods. A moderate coverage of 50% will reduce HIV prevalence to about 20%, which is very high, 20%, right? But imagine that by 2037, if without PrEP, so the prevalence would be 22%. The model estimated 256,000 new infections would be averted over a 20-year horizon if PrEP is used by 50% PrEP coverage for an average of 5 years each. So however, the model finds that the provision of Truvada to 50% of high-risk MSM over the next 20 years would not be cost-effective because the current price is really high, $3,500 US per year. I know that PrEP has been included in Medicare in Australia, I think as early as 2018 or somewhere near that. Correct me if I'm wrong. So the current price is really unacceptable, but it's decreasing, fortunately, especially with some generic drugs. The cost of Truvada would have to be cut by about 50% in order to achieve cost effectiveness. And there is one Chinese study which was designed two HIV fusion inhibitory lipopeptides with highly potent, long-acting antiviral activity and tested in therapeutic trials on macaques. One of the findings was LP98 is highly potent in vitro, ex vivo, and in vivo anti-HIV activities. So that's one of the basic research about PrEP happening in China. In a prospective cohort study in China, the results suggested that MSM on daily PrEP had a high rate of usage, so 30% higher, and a 30% higher of secondary distribution of HIV self-testing kits. The internet-based HIV is a crucial part of the HIV testing strategy paired with PrEP among the MSM population, especially in COVID-19 pandemic and other public health emergencies. It would be promising for peer-initiated expanded HIV testing and maximization of the HIV prevention paired with PrEP among the MSM. So this is a screenshot of they call it HER 健康 or HER health, which is part of the blood. So blood and this called Fanca are part of the blood company. You might know blood is a gay app in China. It has, I think, over 40 million registered users. So which shows how many, how large the MSM population in China is. So in their service, they provide risk assessment by experts, HIV testing services. You can visit their like testing premises, or you can organize your own HIV self-test, which is commercial. And you can also order your PrEP and PEP medicines, and they provide one-to-one consultation service as well. So these are a little bit blurred, but you can see these are the PrEP and PEP users guide and HIV self-test. These are the medicines included in the PEP actually. For PrEP is only Truvada, but this package will be sent to you within 2 hours if you purchase it. It's very costly at the moment, but from personal communication, I got to know that they sell like over 20,000 packages a year. So still they are in high demand. I think this number is still increasing. So lastly, it's about challenges and opportunities. So at a policy level, it is urgent for China to include PrEP as an important strategy for its national HIV prevention plan. And China needs to explore innovative and applicable PrEP service delivery modes to regulate safe access to PrEP. The awareness of PrEP among both key populations and physicians specialized in infectious diseases in China should be further improved. The price of PrEP should be reduced, dramatically reduced. Broader campaigns that address negative beliefs and lack of knowledge around medication safety and efficacy, as well as HIV and sexual minority stigma, should be launched during rollout. But there are some opportunities. Large population of at-risk populations, at-risk populations. So in this table, we can see in MSM, so in PrEP non-users, the HIV incidence is over 5% or 5 to 100 person years. In PrEP users, it is much lower, but still not that low. And in transgender women, the incidence is 4.4% per 100 person years. So the HIV incidence is really high. But luckily, so most at-risk populations have high willingness to use PrEP. I didn't show the willingness to use PrEP among sex workers, but I remember it's very high. Decreasing price and increasing availability. So we can see the availability of PrEP is increasing through multiple channels, through multiple sources. I think the government I think set a bigger store on PrEP in future, and the price is really decreasing a lot in the past few years because of competition of different drug companies, international and domestic companies. Okay, so that wraps up my presentation today. So always be prepared. Thank you very much.
Thank you, Huachun, for that great presentation. I think all of us are really fascinated to hear what's happening in China with PrEP. Your enormous country, that means that there are enormous opportunities for prevention. So I really would encourage people to get the questions up. We have got a couple, but please, if you've been thinking about answering a question, type it in now. Just before we go to those, Huachun, I think the audience may be interested to hear about how it is that most people on PrEP in China appear to be taking a brand name, Truvada. Around all of the world, including the United States now, generic form, or not all of the world, most of the world, generic forms of 2-DF-FTC are available, and in Australia has utterly been critical in the broad rollout of PrEP, so that, you know, PrEP prices are plummeting down and still getting cheaper and cheaper all the time to the government, which means the government's more interested in promoting it. So where is China up to with full access to generic PrEP and decreasing the price of PrEP further?
That's a good question, Andrew. I'm not sure, actually. Just like you know, I'm not sure if the government will like subsidize or reimburse the medicine or PrEP. When will they, accept the generic drugs? That has to be answered, not by me. So Andrew, I'm sorry, I can't.
No problem.
I'm not very sure about that.
No problem, Huachun. I mean, the point I think that it's important to take away from this is that I don't think any country in the world can afford to implement expensive PrEP. And it was even in the US when it was brand named, while they got reasonably large numbers on it, it's still a tiny proportion of at-risk populations, and price is a critical part. I might move on to some comments and questions that the audience have brought up, Huachun. Firstly, from Yanis Hodges Mamalatsis. Welcome, Yanis. Always good to have you on board. He's was interested, as I think a lot of us would be, on that very innovative looking program that you had in China of online consultation and mail delivery, and was interested. Yanis was interested to know how much was the cost of that service in US dollars.
So I think the Truvada costs about 350 Australian dollars.
For how long?
For 1 month.
For 1 month. Okay.
Yeah. PrEP.
Transferring that across to US, that's about $200 US, something like that, or 250.
Yeah, 250 US dollars also. Yeah. And for generic PrEP, it's about, I think, 150 Australian dollars also.
Okay.
Yeah.
Yeah. And so people are able to access the generic if they want it, can they?
Yeah, they can choose.
Right. Okay. Great. There's a question here about uptake of PrEP, and I think it also relates to awareness. I think many of us in Australia are quite shocked by the low levels of awareness of high-risk populations of PrEP in China. In Australia and around high-income countries now, they're pretty high among high-risk populations such as MSM. There's high interest, high awareness, high willingness, but that only came because the evidence of efficacy was so strong and was communicated broadly. So I'd be interested, has there been any open discussion and debate and publicity about just how effective PrEP is in China? And if not, why not?
Yeah, that's something that is not thoroughly done in China. So the communication between researchers, between the health authorities and their target populations is not that good. So, for example, the very low awareness is just an evidence of the suboptimal communication. So researchers and the health authorities should really do more work to filling this gap. When the other reason is in China, traditionally we think all drugs are poisonous, which means if I am not ill, why should I take drug? So people tend to refuse to use any drug if they are not, currently ill. So I think this mentality also is a impediment.
And what should,
is a barrier.
Does that belief vary at all by mode of administration? So, and particularly, would there be any difference, do you think, if there was an injectable form of PrEP? Would people still have that same belief that this is likely to be a poison?
I think it should be similar, but there is a balance, thinking of taking into consideration the convenience and the efficacy and the cost. I think people will make a balanced choice, but generally, yeah, this kind of mentality still is a barrier. How to, communicate with the target population is really, something to be studied, worth studying.
In terms of that, Huachun, China sends very large numbers of young students around the world every year. And I imagine, including yourself, you're a wonderful export and a re-import to China, which is great. But those young students are exposed to cultures now in which PrEP use is very high. So do you think that the diaspora of Chinese students who then come back to China, could that have a role in educating young Chinese MSM about PrEP?
Definitely. I think so. Just now I showed you the graph, which is a man climbing the hill, the rock. That was from Jacked, not a Chinese gay app. But now on Chinese gay app, you can see increasingly more people are putting their PrEP status on their profile. I think some of them might have foreign experiences, and maybe they are influenced by their friends overseas. And I think, yeah, so overseas Chinese, when they return, especially at-risk populations, when they return, they will I think they will have a role in disseminating the message.
Thanks, Huachun. A couple of your audience, Huachun, have asked a question about importation of medicines, because the costs you talked about are really very high, and some men in Australia opt to or have opted over the years to personally import medicine. It's actually legal to do so with a doctor's script in Australia because they could get it cheaper. I think in the future that might be challenged as prices come down even further in Australia, but it currently is cheaper, at least for some men, to do it that way. So would it be legal for men to, and possible for men in China to personally import cheaper generic from outside of China?
Well, it's not clearly stated that it's illegal to do it. People still have their ways, have their sources to do this. In China, there is a profession. It's called drug seller, right? They sell drug. They sell, they import. They kind of smuggle, drugs from overseas, especially from India, and sell it at a very comparatively lower price. But they can still make a lot of money out of it. I know that some people are using imported generic drugs, which is not prescribed by the doctors because it's illegal to do that. Right. But some people are doing that.
So it would be illegal for the doctor to write a script rather than the patient to fill it.
They won't prescribe a generic medicine. They won't ask you to purchase that from overseas.
Right. So Huachun, in much of the around the world now, there's great interest, of course, since the randomized trials have shown that injectable cabotegravir seems to be very highly effective in HIV prevention and in populations
No.
in populations in whom adherence is an issue is probably superior to TDF-FDC. And implementation studies are beginning to be planned and to pop up. So Ben Babington has asked, there seemed to be high interest in injectable PrEP. Have discussions or planning begun for implementation projects of injectables in China?
I think some groups might have been discussing it. For example, researchers who have just done the RCT in China, the oral PrEP RCT in China, they might be thinking about doing that. I think they are communicating with is that Johnson? Johnson & Johnson.
ViiV is the manufacturer of cabotegravir, but
ViiV.
Yeah.
Okay. And another research group may also be thinking about it, but very few people are talking about injectable PrEP. You can see only 7% of MSM know, injectable PrEP.
Right.
Yeah, so I think it's still at its early stage.
Sure.
So Ben, if you are participating or leading some project like that, count me in.
Well, it is interesting. It's an interesting point, Huachun, because Unitaid have recently been are in the early stages of implementing cabotegravir projects in South America and in Africa. There really needs to be one in Asia, where the epidemics are very concentrated in men who have sex with men and other key populations. We really do need a multi-country implementation project of cabotegravir. I think there are obstacles to including China as a site in that, but hey, Huachun, we can talk. And critically, we need some international funding to get something started, because as we know in our region, HIV epidemics are still very much out of control in MSM in many Asian settings.
I would be happy, either to participate in it or to see, you guys doing it. So I would be happy. Yeah.
Well, you can be our advocate inside China, Huachun, to help us get that happening.
Happy to. Andrew.
Great. But Huachun, there's no other questions at the moment, so I just might raise this issue, which is probably difficult to answer, but I'll put it out there anyway. We in Australia now, our community is at risk. Our gay community is so well educated about the effectiveness of PrEP that, we had very simple, straightforward education campaigns telling gay men that PrEP prevents HIV, PrEP works. 70% of high-risk gay men are on it. 50% of we've seen 50% declines in HIV incidence rates in that population. They would be stunned and horrified to hear that there's a country of 1 billion people where awareness is so low. What can we do to help? What can we do to help China, have the discussion it needs to have here, that this is a extraordinarily effective intervention that is very safe, and that leads, and as your population modelling shows, if we roll it out at scale, will lead to dramatic reductions in HIV. Big question.
Well, what you can help? I think it takes political will to do this. Yeah, I mean, how supportive is the New South Wales government, to the PrEP projects, right?
Massively, yeah. Well, and our government was able to listen to the evidence on that, Huachun. We showed them the sort of evidence that you've showed us today, and they could see that if we did this properly and rolled it out at scale, we would see dramatic declines, and that is what we saw. So I suppose it's about trying to convince your policymakers that this is something that would have a dramatic effect.
Yeah, and some policymakers, they have doubts. They have doubts about PrEP because they think this, encourages their promiscuity and things like that. So these are very, traditional and very what preserved, not preserved, that word.
Conservative?
Conservative, yeah.
Yeah.
So there are some policymakers like that.
That's where your STI data from like the European data that you showed us showing no increase in STIs. And I would say about the Australian data you showed on about increasing STIs. Further analyses of those data shows that much of the increase is related to the fact that STIs were increasing anyway before the studies began, and they continued to increase, and they didn't increase any more fast than they would have. So, you know, once you correct for that, in our populations, there's not an increase in STIs.
But just the STI rate, the incidence of STI rate is so high. I mean, in a way that it may frighten some people from using it, because even though an HIV is like only treatable, not curable, and other STIs can be curable, but still STIs are really, you know, really so you don't feel good, right, with STIs, and they repeatedly happen. So I think that how do we solve that? I mean, if you encourage people to take other precautions, you know, to prevent STIs at the same time PrEP use, so will people, you know, do that? But I think most people use PrEP just to be nonchalant, just to be carefree, right? Just to enjoy their life a bit more. But that's a
question. As you could say that women have been doing the same for generations now by taking the oral contraceptive pill, and it's not necessarily a bad thing that people enjoy their lives more. But we do have a very specific question here, which is a really one I would like you to address from Ben Babington. You know, we're really interested in our, of course, you know, Australia is becoming a Eurasian nation, and we have large populations of Asian-born MSM in Australia. And given though what you've raised about the concerns that Chinese MSM have about not taking medications, do you have any thoughts on how we might address those concerns for Chinese men who have sex with men who live in Australia, about how we could address their concerns about taking medication?
So in Sydney, for example, you have very good, you know, like a advocacy group. For example, Team Chen, is that Team Chen? So Ben is very familiar with a team, and a group of people are working in ACON, right? Targeting young Asian MSM. I think it's to engage them in PrEP campaigns in Australia. Probably you should address that issue, that mentality issue as well. I think that will help, like alleviate their concern. Just tell them it's not poisonous. It's not a big deal. Not only, I mean, on top of the efficacy, on top of the you know, other science, but you know, tell them it's not poisonous.
So you think that once that as long as that information is coming from a trusted authority, Chinese MSM will believe that and act upon it? Are there any other beliefs we need to be aware of that? Or is it as simple as educating them and saying, look, studies have been done, there is no serious toxicity, it won't hurt you, and it's highly effective?
Not in my mind, not on my mind at the moment, because you know, organizations like ACON, others have already done a, you know, fantastic job. So yeah, I have no other suggesting for you?
The real challenge, I think, through our region, and not only in China as well, of course, that there are very few areas in that huge area that we call Asia, which currently have PrEP up and running at scale. We have Thailand, which has been doing it for quite a while, but still has a long way to go with scale. Vietnam is beginning to roll out quite a lot, and some of the smaller countries like Cambodia are beginning work, and there's pilot projects here and there, but it's true to say that not many places are making very fast progress. One thing you mentioned was guidelines, Huachun, because I think you did mention that it's part of the Chinese strategy, but you need medical guidelines to help doctors prescribe. So are they planned for the near future?
Yeah, I heard that some key experts in this field are organizing a guideline, because now expert consensus is now there, so it's not far from an actual guideline.
And that could certainly providing education to your medical practitioners, the people who are going to prescribe the drug, is utterly critical. And I think we could certainly say that in New South Wales and Australia, that was critical. And one of the first things we did before we rolled out PrEP was to work with the health department to have local guidelines. And having WHO guidelines actually really helped there as well, and the CDC guidelines that existed before that. So, but I think in China, there's often a feeling that they need, you need to collect Chinese data and to inform Chinese guidelines, isn't there?
Yeah, that's true. It's just like the HPV vaccine data.
Yeah. Sorry, I'm just quickly looking through the questions, Huachun, to see if there's anything else. Yanis has pointed out and put in the chat there for anybody who's interested, a new paper from Germany. One of the issues we have with overseas-born MSM, Huachun, as you know, is that they're not covered under our Medicare scheme. So there are cost issues for the overseas-born. For treatment, there is now a scheme for overseas-born people, even if they're in Australia temporarily, to be able to be treated free of charge in Australia. And Curtis Chan has just asked, is that cost an issue? And I would say that there are discussions ongoing to see whether we could get subsidised PrEP to those, and subsidised PrEP care to people at high risk born overseas. So watch that space. Okay. I think it's 5 minutes to the hour, and we've had a great Q&A. Sorry for putting you on the spot with all of those things, Huachun. Sometimes it's hard to represent everything in such an enormous country as yours in a 1 hour presentation. But really appreciate your being with us today. It's great to have you presenting back at the Kirby seminar, and we look forward to working with you again in the future, sometime soon. Thanks.
Thank you very much, Andrew.
Bye.